know that patients with CML do have an increased incidence of infection when compared with the general population, so there are increased rates of infection, and several studies have shown this. So when we have looked at data from big long-term studies that have followed this over many years, they've shown that there are increased rates of both chest infections and skin infections in patients with chronic myeloid leukemia when compared with the general population who are of the same age as the patients who are being monitored. We know that the immune suppression that we observe in patients with chronic myeloid leukemia can be broadly thought of in two ways. So it can be thought of as being disease-related and treatment-related. So in terms of the disease-related aspects, we know that patients prior to the diagnosis of CML definitely have increased rates of infection. And also those patients who would progress to a more advanced phase in CML, which thankfully is quite rare these days, they also have increased rates of infection. Once people have been stabilized on treatment over many years, then the rates of infection tend to go down. Several studies have shown this. And we've also seen data from various translational research projects that have shown that the immune system is more functional as patients have stabilized on their TKI treatment. With regards to the treatment-related factors for immune suppression, we know that patients who are taking TKI therapy have the potential to have a low white blood cell count, which is a design of the treatments. But sometimes if this becomes too pronounced, then we can see patients becoming what we call neutropenic. This is a term which means that they have low neutrophils, a very important type of white blood cell, which functions to primarily fight bacterial infections. And we know that when this happens, patients would be at significant risk of infection. Thankfully, it's quite rare for patients, particularly once they have been stabilized on treatment for some time, to become neutropenic. And patients will be typically monitored by their clinicians regularly to ensure that this isn't happening. We do advise patients if they have significant fevers or feel generally unwell to seek advice from their medical team to ensure they don't have any signs of active infection and haven't developed neutropenia. We also know that patients who take different TKIs have different impacts on their immune system. So some of the TKIs are particularly immune suppressive when compared with others. For instance, dasatinib is a second-generation TKI, which we know inhibits other proteins which are very important in the immune system with regards to the function of important immune cells such as T cells and natural killer cells. So it's not related directly to the impact on your white blood cell counts, but it's the function of these very important immune cells is inhibited by dasatinib and to some extent other TKIs such as bosutinib as well. So the impact on the immune system is really relative to the treatment that patients are taking as well as their particular specific disease situation. So we know that the rates of infection differ greatly amongst the different blood cancers and different diseases that we treat in haematology. And chronic myeloid leukemia as a form of leukemia is certainly one of the forms that has lower rates of infection compared with some of the other more aggressive leukemias that we see. Having said that, what we would advise our patients to do is typically to make sure they do follow advice from their clinicians and go ahead with receiving inactivated vaccinations as per the schedule, such as a pneumococcal vaccination, hepatitis B and COVID-19 vaccinations. We typically don't advise that patients with CML require preventative antibiotics. That's not normally indicated, although certain special circumstances may warrant that, but generally speaking, that's not required. And we would just advise patients to follow their regular monitoring of their blood counts with their regular team to ensure that they're not developing any signs of low white blood cell count.